You're watching Nevada Business Chronicles. Take a journey with us to see the innovative businesses that put Nevada on the business map. Connecting you with the businesses, events, and organizations that bring innovation and prosperity to the Nevada area, please welcome your host, Mitch Burney. If you or someone you know is suffering from chronic pain or a chronic condition, take a seat, take note. You're going to want to see this episode. Today, we're here with Dr. Martin Rutherford, a certified
functional medicine practitioner and a chiropractor.
In 1979, you got your start as a chiropractor, but since then your practice has evolved into functional medicine. And first, I'd like to explain what functional medicine means and what was it that caused you to get involved with it.
Okay, functional medicine is about working with the different systems of the body to get them to start functioning normally again. That kind of sounds simplistic. It can actually be pretty complex to get that done. And you do it with for the most part, you can do it without drugs. There's diet involved, there's herbs, there's botanicals involved, but it takes a little bit of a team to really pull it off the way it needs to be done. We do work with medical doctors. And so functional medicine is about, instead of treating the symptom, it's about, instead of treating the diagnosis that the person comes in with, it's about finding out how their physiology is not functioning, how's their brain not functioning, how is their physiology not functioning, and getting it to function again, and getting those symptoms to go away because they're starting to be well again. They're actually starting to do well again. For me, I got into it because, having been a chiropractor for a long time, I had developed an interest in chronic pain to begin with because I had a lot of patients that I saw over the years. They would get better, then they wouldn't, then they'd come back, they wouldn't get better. And we started developing some types of protocols for musculoskeletal people to keep them better longer. But then in the end, what happened was I got sick. I was under a lot of stress for a long period of time. And that stress kind of set me up to get pneumonia. Then I let the pneumonia go maybe a little too long. By the time I got to taking the medication to calm it down, suddenly I was pretty sick. I put on a lot of weight, my hair started going away, I started getting like dermatitis, I started getting skin problems, bowel problems. I ended up getting pain all over. I ended up developing pain in my feet. And went to a couple of colleagues, tried a couple of different things, both alternative and medical, and I just started to really kind of sort of understand that I didn't really feel that there was a definitive understanding of what was going on, or if they even believed that anything was going on. So I ended up reading an article on fibromyalgia, which it turns out that's part of what I had. And it was from a gentleman out in Appleton, Wisconsin, who worked with the brain, and we emphasize the brain here a lot for good reasons. He was willing to help me to understand how to work with the brain and do neurological exercises and so forth to calm down those internal stress mechanisms. And then he ultimately introduced me to a gentleman in San Diego, who I believe was the kind of the person who really put functional medicine on the map. He started talking to me about Hashimoto's thyroiditis, celiac, leaky gut. He started to talk to me about autoimmune problems that nobody knew. This was years ago. Nobody had ever heard of this stuff. It made sense. I started doing what he told me to do. I started getting better because of both of these disciplines. And being in the position of a chiropractor, believe it or not, put me in a better position to be able to assimilate these things because I wasn't restrained in such a fashion. Because both of these disciplines, the functional neurology and the functional medicine, are what helped me to get better. And that's how I got into it. And I mean, if you saw me like 7 years ago, I wouldn't be standing here talking to you like this. It was getting pretty ugly at that point in time. And so I was pretty inspired to get better. I didn't really want to go on disability or anything like that. So that's how I got into it.
It's pretty easy to imagine with that kind of personal experience and success why you were bringing this to our community.
Yeah, after that experience, it became very obvious that's what I wanted to do. I wanted to help people the way I had been helped. I am certified in the functional medicine part of it, so to accomplish this, we needed to expand and bring in the functional neurology part of it, and thus that's when we brought on Dr. Gates.
Dr. Gates, nice to meet you.
Nice meeting you too.
That is quite a long set of initials there after your name,
Yes.
Doctor.
So it stands for me being a board certified chiropractic neurologist as well as being a chiropractor.
A board-certified chiropractic neurologist. Okay, pardon me if I'm not alone. Never heard of one.
Exactly. That's because there's only about 400 of us in the world. So it's a unique discipline.
Well, let's talk a little bit, if you don't mind, about what that discipline allows you to do at Power Health.
Exactly. So many of these chronic pain and chronic conditions have a basis in the brain primarily or secondarily. And what we do as chiropractic neurologists, we actually go in and stimulate the brain and get it functioning more normally again. And I can explain that in greater detail.
So what are we looking at here, Doctor?
This is a model of the brain. And the brain in the human body controls everything. And the human brain has different areas that control different functions in the body. For example, this is the frontal lobe. At the front part of the frontal lobe, that's where we think from. That's where positive emotions come from. This area of the frontal lobe is where we move our arms and our legs from. This is called the temporal lobe, where we hear things. Occipital lobe, where we see our visual surround. And then this is the parietal lobe. This is where we feel things. And the parietal lobe is so involved with chronic pain conditions. And just like a computer that can get a virus and not work correctly, metabolic disturbances, meaning stress hormones, immune inflammation, can dramatically affect the brain and the parietal lobe and how we feel pain or pleasure.
Does that hormone production then cause changes physiologically to our bodies?
It absolutely does. And with many chronic pain conditions, with those hormone changes, stress hormones, immune inflammation, it's like gasoline on the fire for pain
Makes
nerves.
sense.
And that's why we have 130 million Americans who have chronic pain, and there's not a great medical solution for their problem. We're not anti-medicine, we work with medical doctors, but we're quoting some of the nation's most prestigious medical doctors when they say chronic pain is an epidemic, and medically there's not a great solution.
Correct me if I'm wrong, but when you think about it, it makes perfect sense. The brain, the neurological paths, and the physiological wellness of the whole body as a unit, if you take care of this core, that's how you're getting out to the symptoms and repairing them or causing them to go away.
Exactly. And then the brain can work better and do its job appropriately so it can innervate and fire the right pathways in that core of the body as you were talking about.
I could not be more excited than to share with people how you actually treat the core of the human being and the brain. Can we take a look at that?
Absolutely.
Let's do that.
Okay, great.
Well, these look like night vision goggles.
Yes, they do, but not really. Those are very powerful goggles that will sense how the eye moves, and it tells us a lot about how the brain is functioning.
Okay, how the eye moves tells us how the brain functions. Makes sense, but what are you looking for?
We're looking to see how the eye moves from point A to point B, how the eye can track a target moving back and forth. If you can look at a target while you move your head, believe it or not, these come from thousands of MRI studies, many from Johns Hopkins and the most prestigious neurological facilities in the country, where they've precisely mapped out in the brain, when you're doing these activities, which area of the brain is involved, being testing, and then we can use that information to rehab the brain.
So basically, you find out what area of the brain is not strong enough, like a muscle in your body, one arm being stronger than the other.
Exactly.
Determine the area that needs the most improvement or work, and then you target that with brain exercises, is what I'm understanding.
Very accurately, yes. And then sometimes
Fascinating.
it is
sounds
fascinating.
so simple, but so complicated too.
Exactly. And sometimes we can go in and activate or exercise the area of the brain that's not working right, and that's not a good thing because it's so weak and damaged that you don't want to exercise it. Think of a torn muscle. You don't necessarily want to rehab the torn muscle immediately. You want to go away from the damaged area of the brain, excite other areas that talk to the damaged area.
Wow, fascinating. Well, let's take a look at how these glasses work. I'm excited
Okay,
to see
so I'll
what
let you
this
put
does.
them on as though you were scuba diving. Excellent.
Okay.
And what I'm going to do is I'm going to close this lens. That way you cannot look at anything.
Yep, I'm
And then
complete
I'm-
darkness here.
Exactly, and it's going to be uncomfortable.
Okay.
And I'm actually going to change the focus here. Okay, very good. So the first thing I'm looking at is to see, are your eyes moving? If the eyes were moving right now, I would immediately know that you have an inner ear problem. But your eyes are not moving, so I know that you don't. Now, I'm going to turn your head from side to side, right, and left. And by looking at how your eyes move, I can tell the integrity of how your inner ear is functioning. Because when you move your head to the right, your eyes move to the left. So automatically I know what is happening with your inner ear. So the next test is where you're going to look at a target. Do you see the red light?
Yes, I do.
So look at the red light the whole time that I turn your head. So I'm going to turn your head to the right and to the left, and to the right and to the left. And based on how you look at the target tells me an incredible amount of information about your cerebellum, the balance center, as well as the frontal lobes, which are involved with thinking, positive mood, as well as shutting off anxiety responses. Next, we go and we have you track a moving target. So you're going to follow the dot on this tongue depressor. So we're going to go up and down, and then we're going to go side and side. And this gives us great information about those parietal lobes I talked about that are involved with chronic pain, as well as your balance center, the cerebellum. Now the second to last test that we're going to do is going to be a test of the frontal lobe. So I want you to look at this target on the right. And when I say go, you're going to look at the target on the left. Okay. Keep your eye there until I say go again when you look back over here. So go, 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 go. So that also gives us fantastic information about the integrity of certain areas of your frontal lobes that are really involved with not only moving the eyes, but how you think, shutting off unwanted thoughts. And the last test is a big test of brain function where we have you look at a red and white candy-striped cloth, and you're going to look at it as it goes to your left-hand side and then to your right-hand side. And now I have a great understanding of how your brain is working.
This is fascinating. Mm-hmm. What did it look like? What were my results?
What I saw is that your left parietal lobe is not integrating well with your left frontal lobe, and how you track those red and white targets as they went by. When I went to the left-hand side, it was not intact as it was going to the right-hand side. Really, the rest of your tests look pretty good. But in our therapy now, I would focus our therapy on rehabbing and strengthening, like you'd strengthen a bicep, your left parietal lobe and your left frontal lobe. And that can have implications in anxiety, memory, and pain.
Very interesting. Very, very interesting. Okay, so once you have all of the eye test done and you've looked at somebody's medical history, give me an example maybe of a case of how you tie that into treatment, for example.
So let's take fibromyalgia as an example. Fibromyalgia patients have chronic pain throughout their entire body. They don't have rheumatoid arthritis, conditions such as that, or MS that are causing their pain. But they have bad frontal lobes frequently, per this exam. A lot of them have been through trauma. Many of them have autoimmune thyroid disease where their immune system is killing their thyroid and it shouldn't. Or their pain nerves are starting to die and degenerate. So let's say they have a frontal lobe problem from this exam. Let me show you on the whiteboard. So I'm going to draw a model of the brain. This is the brain as we look at it from the side. And frequently when someone has a frontal lobe problem, I'll put frontal lobe, anxiety from previous trauma in life, frequently childhood trauma, can start to escalate. And the anxiety patterns in the brain are like a highway. And when the anxiety keeps going, and I'm not saying these people feel stress all the time, but their brain is in a state of stress. And so this highway becomes very, very learned. And it's the frontal lobe, which we just tested, it's its responsibility to shut off this highway. But when it's weak, it can't. So as a result of that, let's come on over here. We have this diagram depicting how every organ in the body is innervated by the stress response. And when the stress response is going at 9,000 RPMs, as an example, then our physiology changes. We flood the body with stress hormones. And those stress hormones bind to pain nerves and make the pain nerves learn pain. But it can also shut off processes like digestion. It can make your heart beat faster. It can make your eyes dry, your mouth dry. It can also change reproductive function. So a lot of our patients who have erectile dysfunction, as an example, if they're a male, can have this sympathetic fight-flight response going on because their frontal lobe is weak.
And so what do you do with that knowledge once you have that? How do you treat the brain?
We strengthen the brain, and that's what I want to go show you next.
I can't wait to see it.
Perfect.
So once you determine what area of the brain to work with, what do you do next?
So then we go in and we start stimulating that area of the brain. As I talked about in the other exam room, when a frontal lobe is weak, then we want to give that frontal lobe exercises. Just like we can exercise a bicep, we can exercise the brain. And so that's what we're doing over here in our brain gym, and we do it all day long. As the day goes on, this area fills up, and we rehabilitate brains in this clinic. Now, the other thing that we have to pay attention to is the metabolic factors affecting the brain. So if someone has inflammation in their body, if they have immune issues, if they have stress hormones, blood sugar imbalances, those all have to be paid attention to for this area of the brain to start recovering fully. It's very analogous to you don't want to go to the gym if you're drinking, smoking, and not eating right.
Well, that makes sense. And so then you're going to start to perform exercises on the brain, strengthening that. How does that then affect the core?
And that affects the core because now once this frontal lobe is working, we can shut off the stress responses, the anxiety responses as I talked about. Or if we get the parietal lobe working well, then we can shut off pain better and we can feel things more normally than abnormal.
I cannot wait for this to air and for people to get an idea of what's possible for them. I understand that we have a patient that's agreed to share their experience from what's happened in their life since they've began treatment here.
Exactly.
Well, let's go meet her.
Okay.
We're so fortunate that today one of the patients that's completed their treatment with Power Health has agreed to share her experience with us, and actually in this case, entire family's experience with us. This is Susan Brown. Susan, thank you so much for agreeing to be on our show.
You're so welcome.
Tell me a little bit about what it was that brought you to Power Health, if you don't mind, and then what life is like now.
Sure. We have a family of 7, and in that group we've had a mixture of different health issues that we've been dealing with for many years. My husband spoke with a business associate of his that had been to Power Health and shared his progress with my husband, who then shared it with me. So I was very concerned about one of my daughters and brought her in to meet with the team here at Power Health. And I was just so impressed with everything that they did for her in terms of screening, being able to identify what her issues were that actually hadn't been identified before. So she began her treatment, and the entire family began to notice the improvement and the changes right away. So then my husband was next in line, and he came, same wonderful results. He was doing really well with some of his health issues. And then I came in and started to be seen by the team. And then I have 2 more daughters that are now under the care of Power Health. So our health issues have really ranged from extreme stress, post-traumatic stress, anxiety, insomnia, digestive disorders, skin issues, and many other things that we weren't quite able to put our finger on as to what the cause was. So when we came here, we went through the evaluation, and everything started to make sense as to what the root cause was that was causing these symptoms. And before, only the symptoms were being treated. But here at Power Health, the actual cause is being treated.
I find this very interesting. It makes sense that inside of a family that you would have dynamics, genetics that play, and that it's a very interesting concept that an entire family could wind up getting well and better.
Right.
Quality of life between when you first were introduced to Power Health and now, how does that compare?
I could tell you my own personal experience. I was experiencing extreme depression, profound fatigue, things that normally didn't tire me before. I was just exhausted at the thought of doing something. And I was noticing a slight change in my personality and demeanor. I was more quick to anger than before. I was a little more impatient than I was before, and I was contributing it to just the stresses of daily life. But after a couple of years of this, I thought something's wrong, something's just not working out here. So I came in and went through the evaluation, started the program, and immediately my stress levels came down. I can handle stressful situations now. I'm not quick to anger. I'm more patient. I'm sleeping better. And one of the wonderful side effects that I really wasn't planning on was that my vision was getting better as well, just in the first few weeks that I had started here. So it's really been a wonderful experience.
I cannot thank you enough for taking the time to share that. I'm sure that there are other people right now that are going, I can relate to that. And the fact that this organization has the ability to impact quality of life in our community is extraordinary. Thank you for sharing that so other people might see the benefit in coming for themselves.
Of course, I hope they will. Please come and get back to your regular self. Be healthy.
So Mitch, this is Nicole, and she's agreed to help us
Nice to meet you.
to show you how our intake process works.
Well, let's go into your office and see how this goes.
Okay. So Nicole, what is it that brought you in here today? What is it that you're looking for us to maybe help you with?
So I was diagnosed with Lyme disease about a couple weeks ago, and I have a friend in my hometown that has been working on a Lyme treatment for about 2 years, and is to the point that she can't hardly get out of bed. She's only awake 2 or 3 hours. And so I'm a single mom and the only source of income for me and my kiddo. And I work for a nonprofit here in town that helps commercially sexually exploited victims. And so I'm on the go a ton, and that's not really an option for me. So I reached out and found another lady that goes to my church who's been through the Lyme process, I guess you could say, and met with her and just asked her, like, knowing everything you've done for the past 10 years, what would you do differently? And she told me about your guys' practice and sold me on it.
Yeah, she had been there and then she came over here.
Yep.
Yeah, I remember that. Okay. Okay, well, let's see what we can do here. What we usually do, is a little different. What we do here, it's kind of a little old school. We find that for when patients come in here with the variety of symptoms that you have, and you have a variety of symptoms, you're exhausted, you have daily headaches, you have joint pains and aches all over. You have depression, you have digestive bowel issues, you have dizziness and vertigo, you have chronic fatigue, and I've already had the opportunity to, we get your records oftentimes beforehand, and I've already had the opportunity to look at your records, and I noticed that you have a rather severe thyroid problem.
News to me.
That must be news to you because you didn't even mark it down here. And so what we have found is these are very complex cases. They have a lot of vicious cycles going. And there's not a lot of testing out there that's good for it. A lot of the patients that are sitting there like you either have tests that are normal or, not unlike you, have tests that show everything on the planet and are about to get off into 26 different treatments. What we've had to learn to do is to take a very thorough history. And a history that's going to be based strictly on chronic pain or chronic conditions. Okay. Because I don't know if you can grasp this, but all of these conditions are probably one or two things that are affecting everything, including the immune system that you may be getting diagnosed as Lyme for. Can you kind of embrace that?
Yeah.
So the process of doing the history is going to take about an hour.
Okay.
And then once we've gone through the history, that'll give me a better idea as to if you're a good candidate for going through our evaluative procedure.
Okay.
That examination is usually about an hour and a half. In your particular case, I'm going to guess you have some stress mechanisms going on since you're working with kids who have been sex trafficked, if I understand what you just said correctly. There's probably going to be some stress mechanisms there. We will actually treat you for that day, reevaluate you, and once we're done with that, we'll have a really good idea not only what's going on, in fact, we'll probably know what's going on, but we'll know approximately what it's going to take to be able to get you through this, and we'll be able to talk about time elements and fees and all those types of things.
Okay.
Does that sound good to you?
Sounds good.
Okay. So having gone over all of your findings from the exam, we know what we're going to do test-wise now. Basically what we do in the beginning is you have a chronic stress syndrome that has to be addressed. If that syndrome is not addressed, we will never get long-term success on you. Okay, we'll get intermittent success, and that's not what we're looking for. We're looking for you to get better, be done, and be out of here and have the tools to stay better on your own. Now, I understand that you've agreed to allow us to follow through on this program for this presentation, and that's something I really appreciate. I think a lot of people will be very excited to actually see what you're going to look and feel like a couple of months down the road. And we're pretty confident that the results here are going to be very good.
Awesome. When do we start?
All right. When do we start?
Right.
Doctor, who should consider contacting Power Health?
I would say someone who has been suffering from some sort of a chronic condition or some sort of chronic pain, and they've tried a lot of things. They've tried allopathic care, they've tried alternative care. They're just kind of confused. They've been on the internet, they've been trying a bunch of things, maybe experimenting, and they're just not getting anywhere. That's really kind of our ideal patient.
And then there are individuals around the world that I understand that you provide treatment for. How does that work if they're out of the area?
We do. We had people here from, I think, 22 different countries over the last year and a half or something. Basically, they see us online. We have over 300 hours online of Dr. Gates and I discussing these different types of conditions, and then they'll contact us. I think it's at powerhealthreno.com. And we have a whole section there telling them how they can contact us and what the programs look like. And so then they call, and Katie usually will handle that.
Well, I understand that you do spend time with them on the phone getting to determine if
Absolutely.
treatment is even appropriate at your clinic.
Yeah, before they came, I was just talking to someone from Russia this morning. But yeah, so to make sure that that person's not going to come here and be wasting their time, I'll usually schedule, it's usually about a 45-minute to an hour consult, just to make sure that they're not wasting their time before they come here.
I definitely want to make sure that people know the types of chronic conditions that you're talking about. Just if you could, some of the more well-known ones.
The ones we see the most, fibromyalgia, peripheral neuropathy, chronic fatigue, dizziness, vertigo, balance, restless leg syndrome. We do gut problems, chronic thyroid problems that aren't getting better, chronic gut problems, stress, post-traumatic stress syndrome type of cases, a lot of stress-related type of issues. Post-stroke, we do some post-stroke work. We do a lot of work in concussions, and we do a lot of things. But those are probably the things we do the most.
It sounds to me like if you've tried and you're ready to give up, don't give up. Come to Power Health.
Yeah, that's a good way to put it. Yeah.
And the website, phone number, address, if you wouldn't mind.
It's powerhealthreno.com. The phone number is 775-329-4402, and we're at 1175 Harvard Way.
I would like to thank you for allowing us to chronicle your business, you and your entire staff for being so gracious and having us here. And I'm really looking forward to the quality of life in Northern Nevada being altered by the work that you do here. So thank you so much for being on our show.
Oh, thank you.
For more information on this guest or to see this show in its entirety, visit nvbusinesschronicles.com. While you're there, you can watch all of our past shows on the Chronicles page and stay connected with us by following us on our social media. For information on becoming a guest on our show, contact us at info@nvbusinesschronicles.com. We hope you enjoyed the show. Thanks for watching. Tune in next week at the same time for more from Nevada Business Chronicles.